Hi, my name is Christina Tackett. I am an Associate Professor of Biology for the Mathematics and Sciences Division at South Central Kentucky Community and Technical College.
All right, so this is an example of a setup I use during the in-person lab with the in-classroom webcams for a staining procedure. So in the past, I would have students come up to the front desk and gather around so they could really see what was happening. This is helpful because they can still see everything that's happening up on the board, and it actually gives them a closer view than they would have gotten before. So they're not having to, lean over another person's shoulder to see what's happening. So for example, I can show them how to add water and stains to the slide and their samples, and they're able to see that on the screen from their desk. And then I can also record this for use later. So once I get it recorded, then I can add it to a Google form in Blackboard, and they can watch it as a pre-lab with some check your understanding questions so they're prepared when they get ready to come to the lab. And they already know what's going to be happening. And then I can also use it for post-lab, check their understanding of the sample that they actually saw on their slide once they completed the procedure. So it's really giving the students a closer view of the procedure and more immediate feedback with the check your understanding questions. Here's an example of the Google Forms that I use for pre and post-lab assessment. The recordings of the demonstrations can be inserted in the beginning of the form along with objectives for the lab exercise. For a pre-lab assessment, questions would check the students' understanding of the objectives presented in the videos before they perform the exercise. These are reinforced with additional demonstration during the lab. Following the in-person lab, the Google form would contain questions related to evaluating and interpreting the students' own specific results they obtained by completing the lab. The students benefit from the more immediate feedback in the forms rather than submitting a hard copy lab notebook a few times during the term. They are more prepared for exams, and students who miss a lab can still keep up with the material. Interaction and engagement with the content has increased with the use of these technologies because students are able to work with the objectives and competencies before, during, and after the lab.
Hello, my name is Mike Greer. I'm an associate professor here at SkyCTC in the Computerized Manufacturing and Machining program. Today we're going to take a look at one of our hybrid classes.
We are using a third party to help us deliver lectures. That third party is Tooling U SME. They offer a range of lessons or modules that we select to meet our competencies and objectives for this particular class. This is where a student sees their schedule and chooses the class they need for a particular lesson. In this case, we're going to choose the basics of the surface grinder for today's lesson. We can see here the options the student has in the module. They have a class outline, they have class objectives, they can even look at the vocabulary for that particular class. Here we're going to start a class, and we're going to look at an outline of what the student may see. Here the student is looking at a lesson on surface grinding. The student here can get a close-up view of the machining process without having to stand around the machine in person. As the video plays, the process is accurately explained. The student can replay the video as many times as necessary to understand the objective. The old way of running the class consisted of students sitting through the lecture as a group and then going to the lab. The hybrid lecture now allows the student to repeat the lecture, review a particular topic, and even print out material for later review away from their computer. They will, of course, return to the lab at the completion of the lesson, watch a demonstration of the topic they have reviewed, and then produce a project in the lab.
Hi, my name is Amanda Smith, and I'm one of the nursing instructors here at the Bowling Green campus. I'm here to talk to you today about the new technological changes we've made in order to interactively engage our students. The first change we've made is recorded lectures. Previously, the student would come in for 4 hours on Tuesdays and 4 hours on Fridays for lecture. Now, we record lectures and upload them to YouTube. The student will listen to the lectures and come in once or twice a week for scheduled question and answer sessions. Q&A sessions can include unfolding case studies, videos, demonstrations, and more. This is similar to a flipped classroom approach aimed at increasing student responsibility and engagement. Students would wait in the classroom for a check-off time until we called their name. This could range from 15 minutes to almost 2 hours. We've altered that system by using Sign Up Genius. The links are provided in their Blackboard site, so they'll go down to Lab Sign Up Genius links. Basically what they do is click on the link and it takes them to Sign Up Genius website, and then they select the time and date that they want. They click sign up, submit and sign up. They enter their first name and last name and their email, and then they click sign up now. This sends them an email when they sign up, and it also sends them an email 1 day prior to their practice or checkoff time. We have the option to use Swift River for virtual clinical. So this site has different types of learning activities such as MedPass, community health, emergency department, maternal newborn. While this doesn't necessarily replace the hands-on experience the student would get at clinical, it does allow for more critical thinking. For example, a student can select MedPass and they will have to administer medications to a patient or patients. They'll need to make sure that they're selecting the correct room with the correct patient. They'll also need to check vital signs, pain assessment, lab values, any kind of allergies, also to make sure that they're giving the correct medication at the correct time. Some of these are often overlooked in the clinical setting because the practicing nurse has already done these checks without consciously thinking about it. This virtual clinical experience really helps the students hone in on their critical thinking skills.